Hi, my name is Alan Geller. I'm the author of the book Scary Diagnosis. I wrote Scary Diagnosis after being diagnosed with MS about 6 years ago, MS meaning multiple sclerosis, and after my wife had suffered her second case of cancer, malignant melanoma, which was more than 7 years ago now. In this little video today, I'd like to talk a little bit about the blending of mainstream allopathic medicine and alternative medicine. And this has been a very eventful year. I'm taping this at the end of 2009, and there have been any number of announcements, discoveries, bits of news that have come out that seem to continually confirm the fact that there are many things that are commonplace in some of the alternative therapies that are now coming full circle and are being looked at and or accepted by mainstream medicine. And I'd like to give two examples of that today. The first is, and I referred to this in one of my other little videos, is herb may offer hope for autoimmune disease. A compound derived from hydrangea root, an herb used in traditional Chinese medicine, halted the progression of an autoimmune disorder in laboratory mice and human cells. What makes the compound halofuginone so promising, the researchers said, is that it slowed progression of the disease without suppressing normal immune system functioning, which is a major drawback to current treatments for autoimmune disease because it increases the risk of infection, and some of the literature would indicate that it also increases the risk of cancer. So here's an herb that has a long history in traditional Chinese medicine that is finally being looked at by mainstream allopathic, pharmaceutical, pharmacological medicine, and lo and behold, gee, what a surprise, it may hold an answer to dealing with a very serious autoimmune disease. So that's one example, and there are many others. I remember when I was younger, acupuncture was considered to be voodoo, and today it's not only used in many, if not most of the hospitals in North America, but it's also being taught. So it's important as a patient for you to get out in front of the curve. The other one, which was the really big news most recently, and if you haven't heard of this, CCSVI, which is chronic cerebro-spinal venous insufficiency, was a huge announcement. There's a doctor, Zamboni in Italy, whose wife has MS, and he headed up a study based on the theory that the veins that drain blood from the brain may be in some way malformed or otherwise blocked in many, if not perhaps all, MS patients, although statistically that hasn't proven to be the case yet. And that because of that, the blood is spending more time than it should in the brain or washing back up into the brain, which may be allowing things that shouldn't be allowed to cross the blood-brain barrier to cross the blood-brain barrier. The work is early. The announcement was really earth-shattering because MS was categorized as a so-called autoimmune disease, and for it to potentially have some kind of a physical or I would call it mechanical relationship comes as quite a surprise to pretty much all of the medical community. It does not come as a surprise, though, to many alternative therapists, which is why I'm doing this video today, because I was diagnosed with MS about 6 years ago, and in addition to seeing allopathic doctors like neurologists, I have seen pretty much every flavor of alternative therapist you can imagine. I talk about many of those in my book. And one common theme that was evident when seeing these alternative therapists were that many of them were concerned with drainage very similar to Dr. Zamboni, and many were concerned with circulation. I will also add that many, if not all of them, were concerned with digestion and elimination. I wanted to put this on video because I wanted to get people thinking about this relationship between alternative therapies and mainstream allopathic therapies, because I think this is a great example of something that's been talked about, known, promoted, and practiced in many of the alternative therapies, this whole issue of craniosacral manipulation and blood flow and elimination and digestion and circulation, which is what I was really trying to get to, and how mainstream medicine, even though most of mainstream medicine and pharmacology has its roots in some of this stuff, seems to have forgotten it and is now coming full circle back to it. And as a patient, I think it's important that you be aware of these things and that you be open to and aggressively pursuing information to give you the ability to make an educated decision about your treatments, whether they be alternative in nature, or whether they be mainstream allopathic in nature, or whether they be, and certainly whether they should be, and I believe they should be, a combination of the two. Granted, it is difficult to find MDs out there who are willing to work with some of these alternative therapists. On the other side of it, some of the alternative therapies have had to do some work to bring up their level of consistency and credibility to the point that doctors would accept them. But I think that we're heading in the right direction. I think there are more doctors out there that are willing to do that. And I think it becomes incumbent, unfortunately, upon the patient to take a stand with their doctors and try to get some of these other things integrated into the process. I give some great examples of that in my book, Scary Diagnosis, not a commercial, just a note. You can search it for free on Amazon.com. And I hope this was helpful today, and I'd like to say thank you for your continuing support and the emails of support that I've been getting. I really do appreciate them. And I'd also like to note, once again, I'd like to thank Suzanne Summers for mentioning my book as recommended reading in her new book on cancer called Knockout. It and all of Suzanne's books are really, in my opinion, must read. She does a great job, and she really works with some fantastic people in producing those books. From patient to patient, I'd like to encourage you to be as proactive as you can possibly be, stay as current as you can possibly stay, and I'd like to wish you your best possible health. Thank you.